the coronavirus pandemic struck in early 2020, St Joseph's was here to help, committing its entire staff, bed capacity, diagnostics, theatres, facilities, and expertise as part of the national response and collective effort to support the NHS. In the face of extraordinary challenges, healthcare was transformed. But St Joe's mission to provide safe, high-quality patient care has always remained, putting in place the many measures to maintain colleague and patient safety. And they continue to work alongside the NHS during these difficult times. While the NHS cares for those suffering with COVID-19, St Joe's helps thousands of patients needing treatment in a COVID-free environment, with staff dedicated to caring for those who need it most. The story of St Joseph's began during the Second World War, 2 years before the birth of the NHS, when the founding sisters committed to bring health and care to the people of a growing community. The Sisters of St Joseph of Annecy were founded in Le Puy, France in 1650. Now an international community of over 11,000 sisters, they live out Father Madei's original vision in communities found in 53 countries around the world. During the war years, the need for hospital care became acute. The 3 founding sisters were sent to London to train as nurses before the opening of the nursing home, a term coined by the government at the time for private hospitals. Through the ages, the Sisters of St Joseph have always been faithful to the ideal of their founder, bringing care and compassion to the sick, the suffering, and those most in need. In 1944, the Sisters of St Joseph's registered charity purchased Claremont House at Malpas, and it became a convent. The convent officially opened at St Joseph's Nursing Home in 1946. It had just 16 beds and 314 patients in the first year. The first surgical operation was performed on the 11th of February 1946. The welfare state came into being in 1948, and patient numbers rose to 427. Clearly, there was a need to enlarge the nursing home. The 1950s saw great change and advancement in both medicine and nursing. The founding sisters agreed that expansion was necessary, so they sold some of the green fields which surrounded Claremont House to cover the costs to build a completely new hospital. The new St Joseph's Hospital opened its doors in 1961, offering 52 beds. A 12-bed maternity unit was added to serve the needs of a growing population. Records show an annual increase in patient numbers from Gwent and beyond. In the late 1960s, Cardinal Heenan and Archbishop Murphy of Cardiff visited the hospital and the new maternity ward. In 1977, Pope Paul VI sent a message of encouragement and support to the sisters at St Joseph's Hospital. Sister Philip, with 2 patients in St Joseph's in the late 1970s. The development of the hospital in the 80s was very significant. It was a time of great change everywhere. The sisters felt that if they were to continue to serve the people, then St Joseph's needed to be updated. Sister Susan was in charge of theatres in the late 1980s. She is the current Sister Provincial. In the 1980s, the Friends of St Joseph's Hospital was set up by volunteers to fundraise for the hospital and later for St Anne's Hospice. The sisters gradually retired from the hospital, and in 2014 it was sold and became privately owned. And today, St Joe's is a true state-of-the-art hospital. 2021 is a momentous year as the hospital celebrates 75 years of care. Now more than ever, collaboration is important. Hospitals will never be the same again, and the team at St Joseph's are closer to each other than ever before, with a sense of common purpose. The hospital continues to support registered charities and the local community, as well as the NHS during these difficult times. Looking ahead, the hospital's vision is to drive innovation and change in healthcare, transforming how patients are diagnosed, treated and rehabilitated. 2021 sees the opening of a new day surgery unit and refurbished physiotherapy centre. St Joe's mission for the next 75 years is to continue to place the patient at the heart of everything and provide the highest standards of patient care with compassion and kindness in a safe environment.